I'm Minot Mayor Sean Sitma. Please join me Tuesday night at 7:30 after the Planning Commission for our State of the City virtual event right here.
I think Minot's community-minded businesses make it magic.
It's Prairie Grit.
Having a strong and progressive medical center like Trinity Health.
I believe Mesa really puts the magic in Minot.
Music is the heart and soul of Minot.
Meeting new faces over a cup of coffee.
Good friends.
Rediscover the magic in Minot.
Welcome tonight. I call the February 1st, 2021 City Council meeting to order. Before we get rolling very far, I think all of you will notice that I am not Mayor Sitma. Mayor Sitma will be joining us by phone. He was in Bismarck testifying before the legislature, so he should be joining us on the phone at some point. Mayor Sitma, are you there?
I am here, President Olson. Thank you.
All right, welcome. All right, with that, I do ask anyone to silence their phones or anything else that they would have with you tonight so that we do not have any distractions. And with that, we will have a roll call.
Evans?
Here.
Janser?
Here.
Olson?
Here.
Pittner?
Here.
Padragula?
Here.
Ross?
Here.
Sitma?
Here.
Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. As we move on to agenda item 3, we do have Lisa Clute with us here this evening from 1st District Health Unit, so I'll call Lisa up for a report. I'm not sure we can hear you. Is the green light on?
There you go. Good evening, Madam Chair and members of the council. Just a quick update. Most of our efforts right now are focused on vaccines, and we continue to watch all of the epidemiology and monitor the and provide PCR testings. We are doing the testing on Monday, Wednesday, and Thursday at 1st District Health Unit. Again, those are accessed by appointment, so call, and we should be able to get you in same day. Those are PCR tests. And we also have testing at MSU on Tuesday and Friday. Those tests are available. Just walk on in, and you can access those tests there. Again, I just want to reiterate that we very much appreciate the Minor Fire Department and the city's response to the Binex testing that has been well received within this community, and we appreciate that very much. So right now, the big thing is the vaccinations. At this point, we are narrowing in on about 40% of our 75 and older within our county are vaccinated. We anticipate that after this week, we have a very aggressive vaccination process through Trinity and the private healthcare providers going on across the district this week, and then we have some doses available this week. Next week we will do vaccine clinics Tuesday through Friday, and we are hoping that we will see the demand lighten on the 75 and older, and maybe ready to move into the next group at that phase. So when we do move into the next group, it will be healthcare providers by invitation first. And so they will be contacting their patients. They will do that the first week, and then we will open it up to appointments at our facility the following week. Some of that is the way the vaccine rolls out. One of the, what they are doing right now is they provide vaccines to private healthcare providers one week, public healthcare providers the next week, and pharmacy the third week, and then keep that rotation going. We have been working very hard with all of the healthcare providers, and we are shifting and moving doses amongst each other to make sure that the demands are met. And so we aren't just doing it, at public health one week. I will say this was the week that pharmacies were to be receiving that, and several of the pharmacy doses were turned back, so they were reallocated to, from this area, were turned back. They were reallocated to First District, so hence we had some appointments that we were able to make, and we were able to send additional doses over to Trinity and other private health cares throughout the 7-county area. So we are hoping that most of our 75 and older population we have met the demand on the request for vaccine. So as of today, we are looking at 9.1% of Ward County has received their first dose, and 2.3% have received their second doses. I will say we're getting very busy with second doses now, so you should start seeing that rate go up. These rates that I'm providing you, I will say that's what's, we've requested the state to provide this information to us so we can use that for our planning and so forth. And they are providing it. We are a little concerned about their denominator that they are using in their calculations. So it is what is being provided across the state, but we are not sure that that number is as accurate as we would like it to be. They're using a denominator from everybody that is vaccinated within the community instead of the your community population. So we will we'll continue to work on that, but I just want you to be, I want to make sure I'm clear on where those numbers are coming from. So I won't go through all of the positivity rates and cases other than we continue to be very pleased with our positivity rate, and healthcare providers are have access. You know, it's certainly not in the situation, thank heavens, that we were in November and December. So we also do want to encourage everybody to continue their mitigation efforts. It's important that we hold these numbers down while we are getting that vaccination and immunities up. So if you watch across the United States, some of those areas are having substantial increases, and we're confident that with continuation of good mitigation numbers or efforts, we can keep those numbers down. So with that, I'd be happy to answer any questions.
Are there any questions for Ms. Clute? Alderwoman Evans.
So Ms. Clute, when we were at our last meeting, we were talking a lot about the Tier 1B.
Yes.
8 subcategories, correct? And we were concerned about, keeping our mask mandate in place until that tier had some substantial progress. You're reporting to us that we're not even done with the first subset of Tier 1B. Is that correct?
That's correct.
So we still have, and I just want to remind people of the subsets that are not vaccinated yet. Persons aged 64 to 75 with 2 or more high medical risk conditions. Staff and persons living in other congregate settings, such as corrections and group homes. Persons aged 65 and older with 1 or more high-risk medical conditions. Persons aged 65 and older with or without high-risk medical conditions. Persons with 2 or more high-risk medical conditions, regardless of age. Child care workers and workers employed by preschools or kindergarten through 12th grade. So we still have substantial, those 7 categories are quite vulnerable folks that are awaiting dose number 1. Is that correct?
Yes.
Okay, thank you.
Any further questions? Alderman Janser.
Thank you, Madam Chair. Lisa, do you have any kind of number on how many residents is I guess as a percentage, is because you gave us a percentage of those who've been vaccinated. Do you have any number on how many residents have already had the virus?
Yes. And I could get that information. I think I may have it. Let's see, Ward County. total positives to date? 8,939.
Okay, so got to do the math, but
Yep, so that's Ward County, that's 8,939 positives to date.
okay, thank you.
I just have one more comment. I just wanted, somebody posted on Facebook, wanted to let folks know, the Minot VA Center is doing vaccinations Wednesday for all veterans over the age of 50 at the Armory, 7 to 5. Call the VA, make an appointment. But that's another resource for folks who have served.
Wonderful. And I do know, also I want to add on that, the Minot Air Force Base has had vaccine available. They are considered essential service out there, so they will be protecting everybody that has access onto that base. So that may include teachers and so forth. So these categories that you're looking at, you know, there are carve-outs on some situations like VA and military and so forth, but that's the general gist.
Alderman Padragula.
Thank you. I just wanted to clarify. So if you're in the lower range, for example, you're not quite 75 and you only have maybe one condition, if you're in that whole range that Carrie read off, you're not going to even get a chance until the week after next, probably, right?
That is likely that we would not be into that 65 and older group. Right now, the criteria says it's 65 and older with 2 medical conditions. I will state that there is some discussion being had about that criteria.
Now, for people who are in those lower groups, although still higher priority than the average healthy young person, should they just wait? Should they call somebody? Should they expect their health care provider, if they have one, to contact them? Or what should they do at this point?
Well, at this point, they should monitor, you know, First District Health Unit websites, Facebooks, and so forth for vaccination dates. Their healthcare provider will be contacting them if they are in that 65 and older group with possible 2 medical conditions. They would then be contacted by their medical provider, and that's by an invite to that. I hope I answered that question.
So they should wait for their primary care provider to contact them?
Correct. However, if they do not have a primary care provider, which a lot of people don't, then they should be watching our website. So we're trying to get the vaccine to the private health care providers first, and they go into that population with their clients, and then we kind of pick up those that may not have fit into that group.
Yeah, and please understand, not in any way being critical. You know, obviously we're dealing with a very, very short supply of vaccinations, of the vaccine, and we only can give what's allocated to North Dakota and to our region. But I guess it just, I'm wanting to get some clarification. I think I did, as to what if you're in that big secondary pool of high-risk people. And it sounds like right now, kind of just have to wait it out.
Yep, I would say at earliest, there may be some contacts by private healthcare providers that, what is it, February 13th, the week of February 13th, excuse me, and the following week. And again, it's all based on vaccine distribution and how far we are into these lists, but that's what we are hoping to do. And First District would open up the week of February 20th for the next category.
Well, I appreciate your candor and informativeness, and certainly wish you the best of luck in dealing with a very challenging situation. Thank you.
Thank you.
I do have a question for you, Ms. Klug. We've heard in other areas of the country, sometimes there has been waste of the vaccine. Have we experienced that here, or have we been able to have enough people ready to receive the vaccine during its time period that it's valid?
There has not been a drop wasted.
Good.
We have people set up that we can call on if we do get an angel dose. Sometimes in a vial, if you tip them just right and you're using the right needle and so forth, or a syringe, you can get an angel dose out of a vial, an extra dosage. That's good. We've heard that across the nation. It really depends on the syringe that you can get access to. So I can assure you, in working with the healthcare providers and with First District, as soon as we get those allocations, a confirmed allocation, we open up the appointments and they are filled. The demand is high.
Well, good to hear. Thank you. Any further questions? Alderman Ross.
Thank you, Madam President. Lisa, first of all, about in between the first and second dose, are the people still, are they still susceptible? Could they catch, after I get my first dose, until I get my second dose, could I still contract COVID?
Yes, and typically that's why you need the second dose, to take your, the effectiveness up to that 95%. So you do receive substantial protection after that first dose, only after 2 weeks, though typically it takes 2 weeks of vaccine in your body, and then you will have substantial increase protection.
So the number of close to 40% first dose is really, it's kind of a, I don't want to say a false negative, but it's a false sense out there, because there's still that 40% could still be targeted and catch COVID until they receive their second dose.
That's correct.
Okay.
And just to be clear, too, I mean, the vaccine is not saying it's 100% effective. You know, we're seeing 95% efficacy rates, 93% efficacy rates. So, you know, yes, that's correct.
Just a couple more
Yes.
follow-ups. Has anything, and you don't vaccinate over the weekends, or do you?
Yeah, we have in the past, and if we need to, we will.
Like this last weekend?
No.
Okay.
We didn't have doses this last weekend.
Okay. So being the county's expert medical officer, were we in a position to lift our mask mandate by an executive order last Friday, in your opinion?
That, well, that's a challenging question. I will respond to it this way. I think that until we see a better level of protection, we need to continue our mitigation efforts. Now, if that is through mandates or not, but I will say that I think until we see a higher level of protection against the COVID, I think that we will encourage you to continue your mitigation efforts. Again, mask mandates, as I always say, masks are one tool of your mitigation efforts, as well as social distancing, practicing good hygiene, all of those things. So, you know, that was a decision that the mayor made, the city made in regards to mask mandates. I don't care how it happens. I just want to continue to encourage people to wear masks and protect themselves and their neighbors until we can get a better protection against the virus.
Thank you.
Any further questions? Alderwoman Evans.
I have a follow-up question to Alderman Ross's. So based on your opinion of just what our vaccination numbers a day look like, How many people would you estimate were vaccinated between 8 a.m. Friday and close of business today in Ward County?
8 a.m. Friday to
So the
close
past
the
2
business.
days, there was no vaccinations given over the weekend, so Friday and today.
Well, there were vaccinations at Trinity, I believe, on Saturday, and at some healthcare providers. First District didn't vaccinate, we were out of vaccine. So I would not say that there are never any vaccinations on the weekends, because I think most of the vaccines that Trinity and other healthcare providers are on the weekends. And we are ready and prepared to stand up on the weekends when we have that amount of vaccine.
Alderman Pittner.
Thank you. Lisa, is there any fear of running short on vaccine for the second dose when people have to come back in that 28-day window? Or are you guys set up and prepared and have allocated orders for that?
Yes, we do. We are making sure that we hold out for that second dose. So if the federal government doesn't have that secured out, we are holding out our allocations for that second dose to make sure that we get the most vulnerable people as protected as possible.
Any further questions?
I don't have a question. I just want to remind people of the First District's website, because that is where your current information is. It's fdhu.org, so that's Foxtrot Delta Hotel Uniform.org. Bookmark it. You and your staff are keeping up on that on a daily basis, and it will be your latest source of information on what category in Tier 1B, and when we get to 1C, we're at with vaccinations and the process by which to go through that.
Well, thank you. I couldn't have said it
Little
any
plug,
better
right?
myself. So,
Thank you, Ms. Kloot.
thank you.
I received no compensation for that.
All right, good to know, good to know. All right, so moving forward, I do have a letter that I'd like to read. It is fairly lengthy, so stick with me. Pardon me. Everyone on the dais has a copy of this letter, but I do want to read it for the audience. It is written by our mayor, Sean Sitma. And it says, with the executive order repealing Minot's mask mandate came ahead of the council decision to reevaluate the issue at the mid-February council meeting. I feel it necessary to disclose the factors taken into consideration. I'd hoped to be present, as with every council meeting, but in-person testimony at the House Appropriations Committee in support of House Bill 1431 had to take priority. House Bill 1431 contains appropriations for Mouse River flood control funding and Minot CTE funding. Factors that were relevant to the executive order removing the mask mandate effective 1/29/21. Bullet point 1. At the City Council meeting on January 19th, I nor any council members were aware of the governor's intentions of reducing the COVID-19 risk level from moderate to low. Bullet point 2. Rolling 14-day infection rate for Ward County, under 5% of those tested. It was actually 3.39% on January 28th. And that was based on information gathered from First District Health data. Bullet point 3, business capacity and operation restrictions removed from the governor's executive order to low risk level. Next bullet point, hospital COVID-19 capacity is sufficient. Next bullet point, as of January 28th, nearly 40% of the 75-plus population in Ward County received COVID-19 vaccination. And again, that's from First District Health Unit data. Next bullet point, availability for Binex testing in Minot through, pardon me, the Minot Fire Department testing location. Next bullet point, optics to state lawmakers considering bills relating to local government powers during emergencies. And these would affect municipalities. Point A, House Concurrent Resolution 3007 is terminating state of emergency for North Dakota. The city would no longer qualify for federal emergency funding related to the COVID-19 response. Point B, House Bill 1260, in emergency declarations that negatively affect business, a moratorium on select department heads, city managers, and elected officials. It does say key department heads and the city manager would be forced to work without pay during any emergency declaration that has an impact on any business. Legal issues of forcing someone to work without pay, likelihood of losing key positions in times of emergency, breaking the city manager's contract. This bill has been amended now to just target city manager and city elected officials. Point C, House Bill 1323, is relating to limitations on mask wearing requirements. These would prevent any municipality from mask mandate in an emergency situation or public health issue. Point D, House Bill 1118, relating to gubernatorial disaster declaration, such as the pandemic. It would require the declaration to expire without special assembly by the legislature, creating bureaucratic process when a process is already in place for the legislature to repeal by calling a special session. State aid or federal aid to local municipalities could be affected. Point E, House Bill 1204, would be relating prohibiting an employee from wearing a mask at work. Substantial health implications specific to the fire department and police department along with healthcare. And point F, House Bill 1259, relating to prohibiting from participating in a wastewater surveillance program unless approved by the governing body. Health officials routinely monitor wastewater for communicable disease. This creates more bureaucracy, not democracy. There are a handful of other COVID-19 reactionary bills under consideration. These listed above are, at this point, highlighted as those of greatest impact to local response and handling of emergencies. By carefully considering the factors outlined above, as well as the political reaction in some of the proposed bills, I felt it prudent to be responsive to the risk level being lowered, hospital capacity being sufficient, the rolling 14-day infectious rate being under 5%, and the vaccination progress moving forward. In a brief phone call with Council President Olson the morning the health risk level was announced, it would be lower. I advised her of my intentions. I also advised that if the council disagrees, a special meeting could be called to override my decision, or that decision could be overridden at the next council meeting. As I have stated prior, I prefer these types of decisions to be made with the full council. Given the nature of the political atmosphere in Bismarck and the lack of timely communication from the governor's office about upcoming changes, I felt it necessary to exercise the executive action. Healthcare officials continue to advise people to follow the recommendations of wearing a mask when around groups of people, practice personal distancing, and good hygiene to limit COVID spread in the community. I am encouraging people to follow those same recommendations that have been in place since COVID started impacting our community. And again, that letter was written by Mayor Sitma. We do have the mayor on the line if anyone has any questions or comments relating to this letter. Any questions? Mr. Mayor, do you have any further comments relating to your letter?
Thank you, Council President Olson. There are several of these different bills that are working their way through the legislative process. Some of them will not gain traction. There are some of them that very likely could pass. The point of the mask mandate being taken out of our hands, I feel would be substantially worse than repealing it at this point at a time when our risk level is low, capacity at the hospital is good, and the other points made, than having that power. And I think the importance of, in a true health crisis, to be able to implement a mask mandate locally. What I see some of these bills as representing, removing local control a piece at a time. Being responsive, I think, is responsible. I will say this. I would have preferred to see this mask mandate continue until vaccination was farther down the road. But with the risk level dropping and the other factors being what they are, I would like to have that option locally of a mask mandate if our numbers spur back up, rather than having the legislature strip local municipalities or local government of being responsive to their own community.
Thank you. Alderwoman Evans.
I take my position as a member of the City Council very seriously. I am entrusted by the voters of Minot to act in their best interests and to do so with transparency and integrity. I believe one of the roles of elected officials is to ensure that the rules of our democracy are followed. One of these rules is not to use the power that is bestowed upon us inappropriately. Last week, I believe the power that the City Council bestowed upon the mayor was used inappropriately. On March 16th, 2020, the City Council affirmed the emergency declaration made by the city manager. The state of emergency for COVID-19 allowed the city to be eligible for state and federal COVID-related funding. The council made this declaration in effect until rescinded by the City Council or until Executive Order 2020-03 issued by Governor Burgum was rescinded. Neither of these actions have occurred, and Minot is still under this emergency declaration. On March 19th, 2020, at a special City Council meeting, the council passed on first reading Ordinance 5486. This ordinance authorizes the mayor to take 29 procedural actions and orders when the city is under a state of emergency. At the introduction of this ordinance, the mayor stated the proposed ordinance grants the mayor certain powers during a declared emergency in order to expedite decisions without having to call special meetings of the City Council. He said a similar ordinance was brought forward during the 2011 flood, but was denied for being too overreaching. Several members of that council in March 19, 2020, went on record that they supported this ordinance, but wanted the mayor to keep them informed. To that, the mayor responded by saying, of course, a critical aspect of emergency situations is that everyone be informed. The mayor also said they are still able to call council meetings for large decisions. On March 26th, at another special meeting, the City Council considered the ordinance on second reading. Alderman Padragula said the ordinance seems warranted given the nature of this emergency, but he had reservations about the impact on it on civil rights. Alderman Padragula offered an amendment that removed the words suspend, limit, or cancel in reference to the mayor's ability to decide if the City Council could meet. The mayor could still postpone, reschedule, or relocate meetings to maintain flexibility. The amendment passed. Alderman Pittner said he trusts that the mayor would, quote, only express his authority in the interest of public safety. At the end of the discussions, the ordinance was passed by a 7-0 vote. Since that time, the mayor has exercised some powers given under Section 238. Some of these have included closing long-term parking at the airport and modifying the airport fee regulations, the extension of the time period in which a temporary alcoholic beverage license can be permitted, and eliminating the $250 fee for license amendments. Also permitting supper club licensees to sell beer and wine off sale, and allowing applicants for alcoholic beverage licenses to pay their license fees in 2 installments. Remaining true to his word, the mayor did bring large decisions to the council, most notably on the issue of whether masks would be required in city buildings, whether mask wearing would be mandatory for city staff, and whether we would require masks to be worn by the general public. On October 19th, 2020, this council, by a 5-2 vote, directed the mayor to require masks in Minot. Regardless if you agree with the decision, the hallmark of a democracy is abiding by the decision of the majority, and even the people who lost that vote respected the decision. The issue was revisited at our last meeting, just 2 weeks ago, on January 19th, 2021. Once again, the council affirmed the mask mandate and agreed to revisit the issue at our February 16th, 2021 meeting. In recommending that we continue with the mandate, the mayor said that based on his consultations with First District and Trinity, the continuing BioNext testing, and the fact that we were not too deep into vaccinating Tier 1B, and I quote the mayor, quote, "It makes sense to continue the city mask mandate for 1 month." He went on to say that the appropriate time for the removal of the mask mandate would involve making progress on vaccinating our Tier 1B people, a reasonable infection rate, and the continued accessibility of the vaccination. So you can imagine my utter surprise when 8 days later, I was copied along with one other member of the council on an email from the mayor stating he was rescinding the mask mandate. To be sure, I am not disagreeing with the mayor's power to revoke the mask mandate. However, I am in strong disagreement on how the decision was made. Let me take a minute to highlight why I strongly believe the mayor acted inappropriately. First, he committed to the council he would bring large decisions to us. And while he did this 2 times with the issuance of the mandate, he does not seem to have even entertained to bring the large decision of revoking the mandate to the council. Since March 16th, 2020, when the ordinance was passed, the City Council has had 18 special meetings on various topics. There is no reason the mayor could not have called a special meeting last week to bring this large decision to the council. He chose not to. Furthermore, the mayor's decision was effective Friday morning. Today is Monday. There is no compelling reason the mayor could not have waited an additional few days to bring this large decision to us. When the council passed the ordinance extending emergency powers to the mayor, it did so to allow the mayor to act quickly and for the safety of the public. It remains unclear to me how lifting the mask mandate is such a pressing public health or safety emergency that it cannot be brought before a special meeting or today's regular meeting of the council. At our last meeting, the mayor stated one of the reasons we needed to extend the mandate until at least February 16th was to allow for the inroads into vaccinating our vulnerable Tier 1B people. What happened to this reasoning, Mr. Mayor? There are 8 subcategories of people in Tier 1B, and we are not even done vaccinating the first group in that tier. In fact, we heard tonight only about 40% of that first subgroup is even done. That is not even half of the first of the 8 groups in Tier 1B. Fourth, the mayor failed to keep council informed. His email stating he was going to lift the mandate was only sent to 2 council members. The remaining 4 had to be forwarded the email from one of those members. This is not acceptable. Why, Mr. Mayor, were you unable to add 4 additional people onto that email or use the email address that automatically sends emails to all 7 of us? If the other 4 members had not been forwarded that email, the odds were they would have found out about this unilateral action in a press release. That is not an acceptable way of governing. While the City Council retains the power to terminate the state of emergency declared in Minot and therefore terminate your emergency powers, we are not going to do that. If we terminate the state of emergency, we would become ineligible for state and federal related COVID funding. And this is not what would be best for our community at this time. 6, it appears that from everything the mayor has communicated that his decision was not based on any COVID-related emergencies or any of the reasons he stated at our January 19th meeting. In fact, he lays much of his rationale on the politics in the legislature. This is not a matter of public safety or emergencies. And lastly, his decision was not made in contemplation of Section 238 or the intentions of council when the ordinance was passed. We did not pass this law so the mayor could act unilaterally in non-emergency situations. It undermines democracy and the duly elected members of this council when the mayor uses powers granted to him in an inappropriate way. It brings me no joy to make this statement. However, I strongly believe that our system relies on checks and balances, and I want to register my disapproval of the mayor usurping the expected process in the hopes it will not happen again. Thank you.
Any further comments?
Madam President,
Alderman Ross?
I know it doesn't need it, but I'll second that statement.
Any further comments? Alderman Padragula?
It's a tough call, and I really sympathize with the mayor, and you know, he's privy to all sorts of political machinations that go on in Bismarck. But I think the argument, the reasoning that Alderwoman Evans has presented is pretty compelling. My primary concern, and I'm willing, please understand, I'm willing to cut the mayor a lot of slack. And when this thing first came up, my major concern was that we could pull back any emergency powers if there was any abuse or misuse of authority. I have no problems with, again, granting the mayor emergency powers. My primary concern, which I have communicated, is the fact that the entire council wasn't brought into this process. I hesitate to say this publicly, but I don't like finding out about important things from the newspaper or a press release. I also don't like staff being informed of decisions that are made before the council is informed. I think that's not a good thing to do. I'm not challenging the decision at this point, but I guess I just want to point out and want to ask for more of a collegial process. I, again, have no problem with the mayor having authority, but I would ask that, you know, if decisions are made, that the entire council be notified immediately. Ideally, that we have consultation, that we talk, and that may be problematic with the open meetings law. But as Carrie said, we can call a special meeting, or someone can call a special meeting. So I'm concerned. I think for the future, what I want to see again is more and earlier consultation and information. And I've said this too from the very beginning of my service on the council back in 1998. There's nothing more frustrating than find out about some important thing happening from the newspaper. No offense to the media here, but the people in charge of the city's governance need to be kept informed. They need to be part of the process. So that's my main concern. And I'm, like I say, a little hesitant about bringing this up publicly, but it's been brought up by other people. And, you know, I feel some sense of freedom now to speak. And again, I don't mean to pick on this individual. This has happened many occasions in the past. And I thought we were moving toward a more open governance structure. And I guess I would just like to see that happen and us keep on that track for the future.
Any further comments? Any further comments? Is there anyone in the audience that needed to comment on this tonight? All right, moving forward, we will move on to agenda item number 4, which is the mayor's report. And I believe that Derek will show the mayor's report for us. It has been filed. I will not be able to answer many questions, but if we do have some questions, we will be able to ask the mayor.
Madam President, if I might, on the mayor's report,
Yes?
just to note that there has been a number of bills that have been testified down in Bismarck. Those are highlighted, and also other side discussions that have taken place, and yet another will be tomorrow on not only flood control but noise and a number of these other bills that have been mentioned. So I am still very much trying to find time that we can get together as a council for legislative priorities, because this thing is moving a lot differently than it has in the previous session. So if anybody has any questions about the report, I'll be happy to answer them as best as I can while I'm driving.
Any questions for the mayor? Any questions? Seeing none, we will move on to item 4.1, which is a proclamation. And this is a proclamation that was written by the mayor, so I will just read what it says. City of Minot Mayor proclaims February 11th Giving Hearts Day. Whereas the goals of Giving Hearts Day are to raise awareness of the charitable nonprofit sector and its organizations in North Dakota, to promote online giving, and to provide donors with the opportunity to multiply the results of their giving. And whereas Giving Hearts Day is a powerful example of the private sector providing assistance to charitable nonprofit organizations that offer vital services to improve the quality of life for many members of our community. And whereas the charitable nonprofit sector supports individuals and families with quality programs, materials, and funds that promote, encourage, and sustain independence and self-sufficiency. And whereas in order to provide these benefits, charities need ongoing funds to continue providing long-term sustainable services to our residents in need. And whereas these charities have demonstrated a need for collaboration and resources and have joined together for this 24-hour fundraising event that is dedicated to inspiring online donations for charities at impactgiveback.org. Now therefore do I, Sean Sitma, Mayor of the City of Minot, hereby proclaim February 11th, 2021 as Giving Hearts Day in Minot, and call upon public officials, businesses, and community leaders, and all Minot residents to observe this day with appropriate activities and programs, recognize charitable nonprofits, their staffs, and volunteers who provide essential services to our community, and support Giving Hearts Day by volunteering or providing financial support to local charities in Minot and Central North Dakota at givingheartsday.org. And at this time, we do have individuals associated with Giving Hearts. They're going to come forward, and the city manager and I are going to join them and take a picture. So give us a quick break to do that.
Are you going to put on the heart blazer?
Well, you know, I didn't bring my heart blazer.
I'm sure they'll lend you and Mr. Stewart then. I love it.
You can stand in front of me. Go photo bomb it. Oh, you're good.
What?
Go photo bomb it.
Should I? Mask on or mask off?
Yeah, I am smiling.
All right.
Thank you.
And because I'm the official website plugger tonight, I just want to remind folks, givingheartsday.org is your main resource to go to this website. Look to see February 11th, Minot and Ward County, and if you're watching this in other parts of the country, what is going on in your neck of the woods is an important day. Our nonprofits, as you heard, from Mr. Burlingame at the end of the year have, struggled with COVID, as many of us have, and this is an important day to give and allow them to continue providing the very important services to our communities across Ward County. So get on it.
Thank you, Alderwoman Evans. Thank you. Best of luck. All right, agenda item 5 is the city manager's report. Mr. Stewart has filed a report. Are there any questions for him? Alderman Janser, are you?
No, I'm grabbing a pen.
Okay. Any questions? Seeing none, we will move on to item 6, which is the city attorney report.
President Olson and members of council, I submitted a written report. I'd be happy to answer any questions.
Any questions for the city attorney? Seeing none, thank you. All right, item number 7 is our consent agenda. All of the items on the consent agenda will be passed with staff recommendations unless one of these needs to be pulled, or one or more than one needs to be pulled individually to be looked at. Is there anything that needs to be pulled at this time? Anyone in the audience that would have an item that would need to be pulled from the consent agenda?
Madam President?
Yes. Alderman Ross.
I move approval on consent items.
Second?
All right, it's been motioned and seconded. Any comments? Oh, yep, and I forgot the correction here. So item 7.9 does have a third recommendation, and that is to approve the budget amendment. So do the motion maker and the second agree with that?
So moved.
And how much is the budget amendment?
We'll find that answer for you.
Okay, $6,000, Alderman Ross, just in case you're curious. I'm fine with that.
All right. Any further comments? Further comments? See none, call the roll.
Ross,
Yes.
Sitma,
Yes.
Evans,
Yes.
Janser,
Yes.
Olson,
Yes.
Pittner,
Yes.
Padrigula.
Yes.
Motion carries. We'll move on to agenda item 8, which is our action items. The first item is 8.1, stacking space approval for the Tidal Wave Auto Spa. Section 11.3J is of the zoning supplement to the City of Minot Code of Ordinances zoning code requires stacking spaces for car washes or those spaces reserved for vehicles waiting in line to be served via a drive-through facility to be approved by the City Council. The recommendation is approval of approximately 25 stacking spaces as illustrated on the site plan provided in attachment A. Alderman Janser?
Madam Chair, I'll move the recommendation.
Second.
It has been moved and seconded. Is there any discussion? Any discussion? See none, call the roll.
Janser,
Yes.
Olson,
Yes.
Pittner,
Yes.
Padrigula,
Yes.
Ross,
Yes.
Sitma,
Yes.
Evans.
Yes.
Motion carries. And I believe I have made an error. I did miss items under the COVID items. Is that, are you wanting to?
There's the two.
The two items, yes, that was my mistake. Let's go back in the agenda and address those. My apologies. So under item 3, there are 2 documents. Mr. City Manager, would you like to address these?
Be happy to. So as I understand it, in previous actions, as was outlined by Alderwoman Evans earlier, Council previously approved policies with regards to the requirement of public wearing masks when inside city facilities. And there was also another policy adopted by Council with regards to the requirement of employees to wear face masks while on duty. And so those are, and as you guys discussed at your last council meeting, those were to be brought to council for reconsideration at this meeting. So that's what is on your agenda this evening. I would recommend, after talking about this with the management team, and the lifting of the statewide and the citywide mask mandate, staff continues to still have some concern with regards to the safety of employees and being able to maintain staffing levels should there be another outbreak of this. So we would recommend that any city facility that does not have barriers available to it, that those facilities still be required to have the public wear masks. We do have some facilities similar to downtown, or not downtown, downstairs in the city hall area where people come in to pay sewer bills. There are sufficient barriers there that staff is comfortable. If public wants to be allowed there without wearing masks, that is fine. But anywhere those barriers are not in place, staff is recommending that the council maintain the mask mandate for the public when coming inside city facilities. And then with regards to the personnel policy, management still feels it's necessary to require the masks of employees when they're in an environment that they cannot social distance. So if they're in an environment where they're alone or can stay 6 feet away from people, then they're not required to wear the mask. But anytime that they are in a situation where they cannot social distance, the mask should still be required for city employees. So that's staff's recommendation for council consideration on those 2 issues.
Thank you. Any questions for Mr. Stewart? Alderman Patrickula.
Just a comment. Again, I'm very pleased that the city manager's reaching out to department heads and that they're having, apparently, by all means, a frank and candid discussion, and that he is presenting to us, hopefully, an accurate sense of what the management team is saying and explaining his recommendation to us. I think that's very desirable and very important, and I want to publicly compliment him on that. Hopefully that's a start of a good working relationship between him and the executive team and them amongst themselves.
Any further comments? What are the wishes of the council?
I would like to make a motion to not grant the extension of these two city employee mandates.
Is there a second?
I'll second.
Discussion?
So I don't do this lightly. I've never went against staff recommendations, but I also feel with the mayor's actions last week and allowing the public to go mask-free, it is hard-pressed for me as I talk to a retail worker and retail workers and restaurant workers this weekend why their health is any less important than the health of city workers, and why are we not protecting them like we are our city employees. I'm going to throw it back to what we've heard a lot at this dais, that this is personal responsibility. I hope our city employees will step up and wear their masks and protect one another and the community, but I am not comfortable with the mayor having lifted the mandate for the general public, continuing this for a select group of individuals and buildings in our city.
Alderman Patrickula.
Let me just clarify, make sure I understand what I seconded. Is the motion then not to continue the mandate for city staff?
That is correct.
Okay. Then I'd like to speak against the motion. I seconded it. I think it's important that everybody, seriously, I think it's important that everybody have a chance to speak. And I made a commitment that I would second and accept in exceptional circumstances anything that anybody would forward. I think it is a predicament. And there is an awkward situation. But as an employer, or 1/7 of the employer of 438 people, I feel an obligation morally to do everything I can to protect their well-being and welfare. Most of our city employees work in situations where they work by themselves or in an office or in a truck or whatever, and are free not to have the mask on. I'm double masked. I have been for a couple weeks, and I intend to until I get vaccinated, and the second time in a couple weeks after that, and the numbers are very high. I don't want to hurt anybody inadvertently, and I don't want to be hurt. So I feel a sense of obligation to our city employees and the customers, the citizens who use our city facilities, to give them every little bit of protection that I can. I also think that we may have a legal obligation. OSHA is currently in the process of coming up with new regulations. Goodness knows what's going to happen at the state level. I understand it may be somewhat awkward for a certain group of employees, our staff, to be asked or be required to do this. But a lot of them are working from home, a lot of work in solitary settings. I don't know that it's going to mean that much of an inconvenience, but I do feel very deeply an obligation for their welfare and safety. We're not out of the woods yet, and I want to make sure I can do everything I can to keep our people safe. That's something, again, I felt and argued for from the very beginning of my service over 20 years ago. What was an issue back then was having firearms in our police cars. And we wanted to save some bucks and not arm our officers the way they should have been and the way some were. And I made a fuss about that. That was the first time I got upset with something in the city. And this is the same issue. We do everything we can to keep our people safe. And I think it's important that we say that. I think it's also somewhat hypocritical. If we ask people, we don't require them anymore, but if we ask people in their businesses to be safe and in their assemblies to be safe and wear a mask, and yet we don't want to insist on that of our own customers and our own clients and our own workers. So I think there's an element of hypocrisy perhaps, but certainly inconsistency. We need to set a good role model. We need to set a good example. We own this business, the 7 of us, on behalf of the people. And I think we need to do everything again to keep our people safe.
Alderman Pittner.
Thank you, Madam President. I will second what Alderman Padragula stated, and I can see where Alderwoman Evans is coming from, but the truth of the matter is this is the position that I've fallen in from the beginning. We have a responsibility for our house. This is our house. We are responsible for the people that come through these doors. We are responsible for the people that we employ. You know, we've all attended DRT meetings or Renaissance zones or sit on committee meetings in these buildings, and we have the public coming in. And if we have a member that tests positive after the fact and we have a close contact, we're running the risk of losing valuable and vital members of our team, whether it be from engineering or public works or legal or city manager. To me, this is the responsible thing to do. And if anything, this sets an example for other businesses. We've seen the mask mandate expire on Friday, but I've also seen businesses state that they will continue a mask mandate and require it and take the responsibility that we're asking them to take. To me, this is to set a good example. This is what's doing best for us and our team. But again, I've taken this standpoint from the beginning. It's not our responsibility to tell someone how to run their business or how to protect their employees or their personnel or their customers. So I won't support the motion at hand. This is our house. Let's take care of our house and not worry about anybody else's. So.
Any further comments? City Attorney.
President Olson and council members, I just want to make sure for the record that this is clarified. The 2 resolutions are in effect until the council terminates either resolution or until the state of emergency ends that the governor has issued. So I think the appropriate motion would be to terminate the 2 resolutions, one for the city building and one for the city employee.
Thank you for that clarification. Would the motion maker like to change that motion?
Yeah.
Yes, and does the
Yes.
second agree? All right. Any further comments? Is there anyone in the audience that would like to comment on this? Seeing none, the motion is to say it again, rescind.
Terminate.
To terminate. So call the roll, please.
Evans?
Yes.
Janser?
No.
Olson?
No.
Pittner?
No.
Padragula?
No.
Ross?
No.
Sitma?
No.
Motion fails. So my understanding is then if we want to leave it in place, we do not need to take action. Am I correct, City Attorney? Yes. All right. Alderman Janser.
Just a question, do we want to, would it take a motion to, I guess, modify, based on the comments that the city manager made, what we have in place?
We'll get the clarification here.
President Olson and Alderman Janser, yes, if we don't want the lobby areas that are not separated by barriers to be included in the mask mandate, that would take a modification of the resolution. They currently include all areas of city buildings.
Okay. I will move that we so modify the existing motion or ordinance.
All right.
I'll second that.
Any discussion?
I can add one thing.
Stuart?
So I do want to point out that this council chamber is one of the areas that does not have barriers. So I just want to be clear that masks will still be required to attend public meetings in this room.
Thank you. Alderman Ross?
Can I get a clarification from Kelly on that? Just going through the resolution 3675, if you go down to number 5, letter F, would that it's my interpretation, unless you disagree and explain to me, that for people delivering a speech or performances for broadcast to an audience, however, these individuals must safely maintain a 6-foot distance. Does that include me? We're broadcasting right now.
President Olson and Alderman Ross, if you can maintain a 6-foot distance while you're giving a speech or performing for broadcast or to an audience, then yes, that would include you as an exception.
So in essence, up
So
here,
like
we
me
would
right
not
now.
have to wear masks.
If there's a 6-foot distance, you wouldn't be required.
Thank you.
Any further discussion? Any further discussion? Anyone from the audience that would like to speak to the new motion? See none, call the roll.
Janser,
Yes.
Olson,
Yes.
Bittner,
Yes.
Rajagula,
Yes.
Ross,
Yes.
Sitma,
Yes.
Evans.
Yes.
Motion passes. All right, we will return to our agenda, which item 8.2, I am looking, I believe I'm in the right spot now. I am looking for a motion to table this item. City staff needs some further information related to this, so if I could get a motion to table.
So moved.
Second.
All right, no discussion needed on a motion to table, so call the roll.
Bittner,
Yes.
Rajagula,
Yes.
Ross,
Yes.
Sitma,
Yes.
Evans,
Yes.
Janser,
Yes.
Olson. Yes. Motion carries. Item 8.3 has been withdrawn, so we will not be taking action on that tonight. Item 9 is personal appearances. This is an opportunity for anyone in the audience to speak to anything that we have not discussed tonight or something that we have. So if there's anyone in the audience that would like to speak to us, you may come up to the podium at this time. One more time, if there's anyone that'd like to speak to us, you may come to the podium at this time. Seeing none, move on to agenda item 10, miscellaneous and discussion items. Is there anything that needs to be discussed? Alderwoman Olson.
Can I ask the
Oh,
city
you're Evans.
assessor to come up? So for all of you who don't know, this is our city assessor, Ryan Komorowski, and he is been called up to active duty and will be leaving us this week. And this is his last meeting with us for a while. And I wanted to express my gratitude, not just for your work as assessor, but in stepping up into active duty. And I promise you we'll keep your seat warm, and we look forward to you and your family returning to Minot when you are done.
Alderwoman Evans, I appreciate that, and I look forward to my hopefully sooner than later return to work here for the city of Minot.
Thank you, Ryan.
Best of luck. Thank you.
Stay safe.
Any other miscellaneous or discussion items? Seeing none, item 11 is adjournment.
So moved.
Is there a second?
Second.
All in favor, say aye.
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 We are adjourned.
Mayor Sitma.
Is now exiting.
Thank you.